Welcome everybody to our YWCA South Florida Speaker Series. If we've never met, I do know quite a few people in the room, but if we haven't met, my name is Sarah Coleman. I am the Senior Director of Race and Gender Equity here at YWCA South Florida. I want to thank everybody for taking the time to join us today. I feel like typically these first 2 months are generally quiet, but if you're like us here at YWCA, it has been sort of pedal to the metal ever since we returned from holiday break. So we are very appreciative of your time. So some of you may know, some of you may not, but last December, YWCA South Florida hosted our Her Miami Women's Voices Shaping Community Services report launch, along with our partners at FIU Jose Pérez Metropolitan Center. We shared and discussed the data and recommendations from that report. We had a wonderful discussion regarding those recommendations and what community organizations are doing about sort of the issues that were highlighted in that report. So if you missed that event, you did miss treats, you did miss a beautiful view, but you are in luck because today we're going to do the whole thing over again, except this time you are here. So we are happy to have you. All right, as I mentioned in the beginning, if you're familiar with Mentimeter, you can go ahead and scan the QR code. If you have not entered your names and info in the chat, go ahead and do so. We will be using this Mentimeter feature towards the end of the presentation. If you do have questions along the way, feel free to enter those in the chat as well. Victoria, Maria, who I'll introduce in a few minutes, will be watching the chat along with Taylor, my colleague, to make sure we answer all your questions, but we will have time towards the end to do some question and answer. All right, so let's get started. We just went through our housekeeping, but I wanna go through and tell you the story of Her Miami. I want to tell you how it started, where it started, why it started. And then we will be joined by our friends at FIU to go over the results of this study and the recommendations. We will have interactive discussion using our Mentimeter, and then we'll close it out with some questions and answers. Okay. So the concept of Her Miami it's a project aimed at creating a gender-focused space where women can access information, resources, and opportunities all in a coordinated and simplified manner. It is meant to be designed by women for women. So none of this going to one website for one resource, going to the mom chat for another, heading to the local library for this resource, and then finding out that actually none of them are updated anymore and we've got all the wrong information, so we have to start all the way over. So where we started, we partnered with Florida International University's Jorge and Pérez Metropolitan Center to conduct a comprehensive 3-part study. We grounded the project in the lived experiences and needs of women who live and work in Miami-Dade County. So together with FIU, we surveyed 764 women in the community. We hosted 13 focus groups in person and virtually in Spanish and in English, and we had 73 participants total in those focus groups. All of the women we spoke to were compensated for their time and for sharing their voice in this project. I want to talk a little bit about what we will hear when FIU comes in to talk about the data and the recommendations. There are just a few things I want you all to keep in mind, and I want to start with this quote. This quote was from a middle-aged focus group participant, born and raised in Little Havana. She attended our focus group and actually brought her mother with her. This quote Sometimes I feel like I'm in love with a city that doesn't love me back. This woman expressed how difficult it had been in the last few years to access resources, not just for herself, but for her mother. She also expressed how difficult it was to be active in the community. It felt like it was too hard to be active in the community. She wanted to be active, but it was really difficult for her to be. Um, and so when she said this, it sort of made me think, wow, this is exactly why we're doing this project. Because we want to know why it feels like it's so hard for women to get along in this city. So some things I want you to keep in mind as we go through the data, as we go through the recommendations. Um, there are some really compelling data points in this study. Really, really compelling, really interesting. And the recommendations in this report may not seem like that mind-blowing, but they are, in fact, they are the points that these women have made that are really, really important. And even though we know best practice in service and community organization service, um, we have not been doing it. We have not been keeping up our end of the bargain. So all of those best practices that we've learned in our nonprofit careers and our service careers, women are telling us that they are not happening. We need to listen with the understanding that when a woman comes in to receive services or begins a search for resources, she is already starting with the barrier of being a woman. She comes in as a woman, and then we add on a mother, or we add on caregiver, or we add on in school, and then we add on health insurance. We add on all these different layers. But what we're starting with is a woman, and that in itself in Miami and in this nation is a barrier. And finally, all the women we met, all of the women that the 763, 64, 73 focus group participants, all of them love their communities. They spoke so much about how they love the diversity of their community, how active they were involved in their community, how in touch with their neighbors they were, how there was plenty of references to mutual aid, even if mutual aid wasn't used in that text. So I want you to keep those things in mind. And I'd love to introduce our partners in this project, some of my favorite people, and I'm so happy we got to work together for this. From FIU, Dr. Maria de Ilcheva, Associate Director of Planning and Operations at FIU, and Victoria Lerma, Research Specialist at FIU. And I will stop sharing my screen so they can share theirs.
Hello, everyone. Can you see me? Can you see the correct screen with the presentation not in note view?
Yes, Vicky.
All right, perfect. So thank you so much for your kind words, Sarah, and thank you for allowing us to speak with all of you today. As Sarah mentioned, my name is Victoria Lerma, and I've had the pleasure of working on the Her Miami study led by YWCA and on our research side by Dr. Maria Ilcheva. It has truly been an honor for me and our team to be part of this study. This study consists of three major components. As Sarah mentioned, the online community survey available in English, Spanish, and Creole, with 764 women who live and or work in Miami-Dade County. The survey ran from May to October of last year. The 13 focus groups with 73 participants in English and Spanish, and a demographic snapshot of the condition of women and men in Miami-Dade County. The main finding from these three components is that women in Miami-Dade County continue to experience persistent disparities in terms of economic stability, mental health support, access to healthcare, and other social issues, despite there being resources available across Miami-Dade. Women are often unaware of resources and programs, face access barriers, or fragmented systems. The women who completed our survey were from different backgrounds. And as we discuss the survey information, whenever you see N in a chart, that means the number of responses. And in this particular chart, the percentages exceed 100 as they could select more than one race or ethnicity. 1 in 4 women were between 35 to 44. Many had graduate or professional degrees. And as you can see, over half were Hispanic or Latino, while 1/3 were white and Caucasian. 1 in 4 earned less than $50,000. We had 13 focus groups, 11 were in English, 2 in Spanish, 9 were virtually via Zoom, and 4 were in person at YWCA and partner sites. We grouped together similar questions and identified 6 thematic areas for these 73 participants. Our analysis was done by a researcher as well as summarizing through ChatGPT, with everything cross-verified by the research team. The women who participated in our focus groups were also from different backgrounds. In sections, we combine the different components into themes. This section is based on US Census data, and it's for 2024. And we see that we women are a majority of Miami-Dade County's population, 50.8%. Yet we have a large earnings gap of median earnings with men of 12.5%, with men earning over $52,000 and women median earnings $45,611. And you're going to see this gap across every level of educational attainment, with the highest gap at the highest level, or those with graduate or professional degrees. Whenever you see quotes throughout the presentation, these are from our focus groups. This was a very interesting quote that a resident shared from Florida City in one of our Spanish focus groups. Our survey asked about the top 3 economic concerns from women, and they could select up to 3. So the percentages will exceed 100. Interestingly, the top economic concern was the cost of basic necessities like food and clothing, then affordable housing, and then the cost of healthcare and medical expenses. In our focus groups, women often identified that they were struggling to make ends meet and living paycheck to paycheck in an economy with stagnant wages. Our survey also asked about women's top 3 social concerns, and we did not survey men, but if we had, I expect that we would have seen them mention traffic and road congestion among their top 3, as well as environmental concerns. But the one that was really interesting was that the top social concern was managing work-life balance. And we heard more about this in our focus groups. Women often mentioned that they were juggling roles as employees. I know I'm guilty of this one myself. Parents, caretakers of elderly and disabled residents, etc. And all of these roles not only affect their time, but their physical and mental health. What we found is that women face challenges that are often interconnected and exacerbate or complicate each other. For example, we start with lower median earnings, and this creates unique challenges for women. The systems that are in place, as Sarah had mentioned, are not necessarily created with women in mind. So we are accessing childcare services, healthcare services, and even employment opportunities that are not necessarily focused on serving women. And with that, I am going to transition to Dr. Maria Ilcheva, who will discuss healthcare and mental health.
Thank you, Victoria, and good afternoon, everyone. I'm glad we have so many familiar faces and other not so familiar who we are bringing into our circle to talk about important issues, not just for women, but for our community as a whole. I want to go back to an earlier point that Vicky mentioned as an economic concern. If you recall the chart that she showed, almost 4 out of 10 women indicated healthcare and health insurance. And we asked some very specific questions on that issue, both in the survey as well as in the focus groups. And you see the findings on your screen here. So women reported significant challenges both with physical and mental health, with very similar ratings in the survey results. About 1/3 described their health as very good and 16% as excellent, but 1 in 5 women actually rated their physical and mental health only as fair or poor. Adverse health outcomes are likely related to insufficient care many women receive for various reasons. And I want to mention some national statistics that may help explain this point. The US Census Bureau data shows that approximately 11% of women were uninsured in 2024. However, estimates indicate that about 1 in 4 women are underinsured, meaning their coverage does not really protect them from high healthcare costs. So combined, this means that around 1/3 of women, approximately between 33 to 35% in the United States, either lack insurance or health inadequate coverage. That's why health concerns are such a critical issue for women or challenge. These statistics, by the way, explain what our survey results also show us, that many women skip essential care. 18% missed prescribed medication, 27% did not pick up their prescriptions, and over 30% skipped recommended treatments or preventive screenings. These results highlight the need, again, as Vicky mentioned, for accessible, empathetic healthcare and mental health support that is indeed responsive to women's needs. Next slide, Vicky. In our focus groups, participants emphasized that solutions to community challenges should focus on access to information and resources. That's what we set out to find, whether that's a need. Affordable healthcare, mental health support, economic opportunities, empathy, and some of them specifically alluded to systemic change. Again, the fact that them being women, that their identity being female, in many ways either precludes them from getting what they need or presents a significant barrier, even if they know where to find the resources to access them. Women said that while some government, nonprofit, and educational programs exist, and they identified some of them, recognizing them for their work, they still mentioned that awareness of these resources is inconsistent and, more importantly, often relies on word of mouth. That could be a challenge, whether accurate, current information is indeed reaching the people, the women who need it. In some of our focus groups, when one participant mentioned resources, other participants were writing them down because they either needed those resources themselves or they knew of someone who could potentially use them and wanted to provide it to them. Next slide, Vicky. Another revealing finding from the survey was the strong support for women's empowerment initiatives. For women, that may not come as a surprise, but I often cite a survey data from a national study that showed about 4 in 10 Americans actually don't believe gender inequality is a problem. In other words, they think we're all equal, everything is copacetic in our country. So when you read these findings, bear that context in mind. 90% of our survey participants said that such programs, women's empowerment programs, positively impact society. And an even higher percentage, 93%, believe it is important that women have the same opportunities and rights as men. However, women's empowerment is aspirational. Perceptions of equality remain low, with about 73% disagreeing that women are treated equally to men in the workplace, and 77% disagreeing that women are treated equally in society. Again, our data from the perspective of women contradicts the national data that equality has indeed been achieved in the United States. One focus group participant actually highlighted employment challenges, and she specifically noted that there is a gender bias in her field, in her role, which was cybersecurity. Overall, the findings again underscore that gap between aspirations for equality and the lived experiences of women, and thus emphasizing that we need targeted empowerment strategies. Next slide, Vicky. So taken together, these research findings led us to 6 recommendations. The first one is a no-brainer. To ensure inclusivity, resources should be available in the languages of our community, at least English, Spanish, and Creole, but some actually mentioned other languages like Portuguese or Russian. We have quite big national groups from these countries. Multilingual communication fosters trust and ensures that diverse communities feel represented, supported, and first of all seen. Just having that as an option, even if they speak English and feel comfortable communicating in English, makes them feel seen. Secondly, women should have multiple options for accessing services. Online platforms, including website and apps, phone support, live chat, in-person assistance at community locations. We think that in today's digital world, it is sufficient to just put a website with resources, but obviously, regardless of how current and accurate and targeted these resources are, from the perspective of women, quite a large proportion of them prefers human interaction. So this flexibility will ensure that no woman is excluded due to technology gaps or a preference for such human interaction. Third, we recommend the development of a centralized, curated resource directory that provides accurate, up-to-date information organized rationally by category and location at least. Again, it seems like a no-brainer, but such a resource doesn't exist, right? Information is dispersed, and for somebody to navigate all the different sources of such information, given these multiple intersecting complex challenges that most of us experience, is time consuming. If women need to spend too much time on something, they're likely to give up and ultimately not receive the support they need. Next slide, Vicky. The next set of recommendations, 3 recommendations, focus on collaboration, information needs, and accessibility again, because it's so critical. These are 3 pillars that can truly transform how women engage with resources. Partnerships between trusted local organizations, and that will include nonprofits, governments, schools, and faith-based groups, to share resources, update information, and provide it to women in real time. When organizations work together, women will benefit from such a strong, more unified network of services, a seamless service delivery, as we call it in the nonprofit world. We also need to address information needs comprehensively. It should include topics and resources that we identified as important to women, from housing and economic opportunity to childcare to financial stability, education. All of these comprehensive resources are needed. And finally, accessibility matters. That resource hub must be easy to navigate, clear visuals, various filters. A well-designed platform ensures that women can access accurate information without frustration, because we know that when resources are easy to find, they're more likely to be used. My final slide, Vicky, if you go to it, shows our contact information. You can certainly reach out to us at any time. But I want to end with these words. This study highlights the truly urgent need for systemic change to ensure that women have equitable access to healthcare, economic opportunity, and community resources. And why is it so urgent? because we've been in this system that doesn't treat women as valuable members of society or deserving specific targeted attention for too long. It is urgent because we've had decades of systems that don't work for women. And only by focusing our efforts on at least starting to build these systems or change the systems that exist that are not working for us, can we truly create a stronger, more supportive environment where women's voices, going back to the original point of this project, truly shape the future of Miami-Dade. Women are community. If we don't take advantage of what can be done to support women, we're leaving valuable members of our community unsupported, unheard, and under or unrepresented, and that is only detrimental to us as a society as a whole, not just to women. Thank you, Sarah. Thank you, Vicky, for partnering on this. Thank you all for listening, and I look forward to your continued engagement with this work, your questions, and I hope to see a big pickup in accessing the report and the various resources, which will tell us these issues matter to you and you want to continue to be engaged with this work.
Sorry, I was on mute. Thank you, Maria. Thank you, and Victoria. Thank you both so much for sharing that. As I mentioned before, if you do have questions, put them in the chat. We will have a little bit of time at the end to go through questions and answers. But if you don't want to forget them, like I typically do, go ahead and pop them in the chat. I'm going to share my screen again. Let me know if you can see it. Sharing. Okay. So many of the recommendations that Maria went through were based on a few barriers that we pulled out of the data that were highlighted as some of the biggest barriers women are facing in our community. That first one is long wait lists and long wait times. I don't know if you're like me, but I have experienced leaving a doctor's office without seeing the doctor many times because the wait went on and on and on. And help, I was going to say, God help you if there's a child involved, because if you're sitting in a waiting room for an hour and a half, 2 hours just to get an appointment with the doctor or just to see the doctor, you're not staying. So that missed healthcare, that skipping out on preventative healthcare, all of those things have a huge impact. And when there's a long wait time and a long wait list, it just doubles the impact. Resource awareness. Just through the Women's Fund landscape report, we know that there are 170 plus women serving organizations in Miami-Dade County. And we maybe heard about 15, maybe 20. And so it just really highlighted that a lot of the women we spoke with had never heard of some of our organizations, including YWCA South Florida. So how are we making women aware that we serve women? How are we making women aware that we have a gender-focused service that will recognize their full identities as women? Complex paperwork. I mean, filling out a Medicaid form these days, going from office to office, 5 different places to get the information that you need. Inconsistent communication. This referral loops, it referred to dead ends. So clicking on a link and the page saying not found. How many times have one of you gone to a website to find something, it didn't exist, and you really didn't come back to that subject for another week just because you couldn't find it with the 10 minutes that you had during your day? We don't necessarily have hours and hours to look for something, and so if we can't find it quickly, we're more likely to drop it and come back to it later. I mentioned referral loops again, dead ends. digital literacy and self-advocacy. And this came with the recommendation of in-person and virtual options. We had so many women tell us that they just wanted to speak to a person. I know we're all, especially since COVID, all in this digital virtual era where we think it's easier, it's more convenient. And in some ways it is. We hosted 13 focus groups, and I would say, our more well-attended ones were the virtual ones because they were accessible. Accessible to schedules, accessible to the women we spoke with. But in person was highlighted by the women we spoke with as very important. I can't stress enough that a lot of these women we spoke with talked about empathy and compassion quite a bit. Feeling like they were on a conveyor belt, just one after the other, services, services. Here you go, 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 go. Empathy and compassion came up a lot. And then the final one, which I think is one of the most interesting pieces of data, consistent transportation challenges. One of the top economic concerns that women told us about was traffic and road congestion. And it's just so interesting because I think last week the Miami Herald wrote an article about what traffic is doing to Miami-Dade's employees, waiting in traffic for hours, taking forever to get from place to place. And the economic concerns that women mentioned, this was in the top three. It wasn't childcare, it was transportation. And so I think we really need to understand that this time in this place, transportation is huge. It is just a huge barrier that a lot of women, young, old, in between, are facing. And it's something we need to address. Okay, so I am going to go into our discussion questions. If you haven't already joined the Menti, go ahead and hop onto menti.com and you can use the code at the top so you can participate. Okay, I'll give everyone a second to do that. And to Taylor and Maria and Victoria, I'm unable to see the chat right now just because I'm sharing my screen. So if there are questions in the chat, just... Okay. All right, here we go. Okay, perfect. Thank you. So this is a question for everyone. And even if you're not in like a service organization, how are you letting people know about the resources you have? How are you addressing gaps? What gaps have you noticed? Yeah, let me know. Let's have a conversation because I think we all think that we're addressing gaps. I think we all think that we have it in Spanish, we have it in Creole, we put it on social media. I got to tell you, the amount of women who told us that they are not looking for things on social media. The first answer is social media. Networking and partnerships like this. Absolutely. We have to work together. Patient advocacy groups. Word of mouth. We heard a lot about word of mouth. And Maria and Victoria, feel free to jump in if you remember from the focus groups hearing how women were getting their resources. Conducting needs assessments.
Yeah.
Mm-hmm.
That fourth one that appeared, word of mouth, that seemed to be the dominant, right? What they heard from a family member, a neighbor, at the grocery store, from the cashier. Word of mouth is the most consistently identified way in which resources are become known to women.
So word of mouth, how do you build a system for word of mouth? I know for me, it's like the mom chat, right? I can find everything from a roof guy to and urgent care, specifically a pediatric urgent care, to someone to clean my closet. Like, it's bananas. The mom chat is, like, I would say, one of the most incredible systems of resources I've ever been a part of. So, word of mouth is huge.
You can
Okay.
open it for discussion, but I think word of mouth is so powerful precisely because the gaps exist, right? Because the barriers exist to accessing such information in one place.
Yeah. And I do.
Especially for people that are that may have like digital access issues and
Hmm.
barriers. They're relying on their kids or grandkids who may have mentioned something or their neighbor. They're not going on the internet to look for things.
Or
Right.
even WhatsApp groups, right? Because that is, as Sarah said, word of mouth. You don't need to be specific, especially digital literate, to be able to use WhatsApp.
Right. And there's a lot of empathy in, and I keep referring to the mom chat just because that's mine, but there's a lot of empathy in there because they identify with one another as moms, right? And so they already have this layer of understanding and sort of like less judgment and more empathy. So I think about this a lot because it's like such a good such a good example, but um I'll read a few of these. Conducting needs assessments, working with a coalition of like-minded organizations. This was a big one. Women felt like services were so scattered, that there was an issue of duplicating services, and everyone like sort of not working, not necessarily not working together, but not sort of amplifying each other's resources and opportunities. We all work together all the time, right? But they may not know it, and we may not be getting out or amplifying each other's services or resources or opportunities as much as we should be or could be. Okay, and I'll go to the next question. How are we delivering our services through a gender-focused lens? If you're not a women serving organization, this might be a little tough. But you can still understand that if your staff, if your employees, if you're the women you are serving, if you even if you serve men and women or anybody, um, how are you understanding that women are coming with more than just I need Medicaid or I need healthcare or I need childcare?
Maybe the question could be, are we really delivering services through a gender-focused lens, right?
Yeah. Are you? Yeah. Are you even doing that? Yeah. I can be totally honest and candid. YWCA South Florida has not always done this. And more, I would say, in the past few years, we have tried very, very hard to use an integrated service model. And basically, that means when a woman comes in to put her child in our Head Start program, we work with her to identify everything else that she might be coming in for. So she's coming in for one thing, but we're saying, okay, well, if you need childcare, maybe you need this too. Or what else is going on? Like, we have so many services, and people think we're one thing. So we make sure to share all the other things because as we say, once you are a part of YWCA, you're sort of like a part of the family. Um, and through an intersectional lens, considering all of the identity markers and experiences that the participants are walking in. Yes, absolutely. We're not all one thing. No one is one thing. Hmm. Any other, anybody else want to hop in? I see that my organization uses a patient-centered focus to identify the needs of the individual. I don't necessarily see gender focused, though perhaps that's included in patient centered. I think person centered could be on the same level. trying to adjust our programs appropriately based on opinions, needs gathered in our surveys year after year. Surveys, yeah, absolutely. Yearly surveys are that's not something I've heard yet, so that's a great one. Okay, and I'll just move to our next final question. How does your organization manage access issues like referral loops, dead ends, keeping information up to date? We had women tell us that if we were going to have a digital resource, it needed to be up to date to like the day, to the week. So many women expressed frustrations with outdated information. Resources that existed 1 year were still up on a website, but hadn't existed for forever. So, how does your organization manage access issues like that? And for us, to be completely honest, if we were to have information updated as frequently as we would probably need to, it would probably have to be like a person's job, like devote someone devoted to this because it's a lot of work. Does anybody else have anything they want to share? Okay. Maybe it's just taking a while to load. Mm, assuming collaboration between IT and marketing. Yeah. We offer warm handoffs or referrals. We call before we refer and we follow up to see the outcome. I love the following up to see the outcome. That's so important because that's how you learn about these access issues. You share the information with other departments. Awesome. Very cool. Okay, I guess that might be the end of our responses. Okay, so, oh,
Oh,
one more.
welcome.
Hire someone specifically to research, update, and vet resources. And I think that is an answer for a lot of us. I think also, though, thinking outside the box when it comes to resources and research, and vetting those resources. I find a resource I never knew about every week. It's wild. So, I think we're all used to the names like YWCA or Women's Fund or um, there's a million, but looking up some of those new ones, some of those more recent ones. Okay.
And I want to
All
say
right.
that technology, I mean, obviously is important, but there is nothing to replace, someone physically verifying that the resource is still there, that, that it's still being, that program is still being funded, what the
Mm-hmm.
eligibility requirements are. That's not something AI can do for you because AI just relies on what's out there in the public space, and that in itself may be inaccurate. So it's an investment. That's the bottom line in time and
It is.
resources.
Yeah, but I remember specifically one young woman with a child with two women with children with disabilities during one of our first focus group. Them talking about the struggle of getting help for their children, just the scavenger hunt for resources. I mean, I was frustrated for them. It was hard for them. And so I just think, yeah, making sure resources are actually accessible, like actually accessible, is really important. And this sounds, like I said, best practice, make it accessible. But if you go to your website right now and just do a quick review, is your process actually accessible? It's really important to review it. Okay. So, um, here's what you can expect. from us, YWCA. We are going to be using this data and the recommendations from FIU from this study. It will inform our practices, programs, and services. We will be activating this data and the recommendations in our community through workshops, virtual speaker series like this one, trainings, and much more. We will be reaching out to everyone who attended to do a survey and have more information on how to be a part of this progress. I would say every Wednesday, Thursday for the next 5 weeks, we'll be breaking down each one of these barriers in an e-newsletter. So if you got this initial invite and newsletter, then you are probably already subscribed. So you will be getting a more in-depth view at each one of the barriers we talked about here today. But yeah, if we have questions from the chat, I will stop sharing my screen and we're happy to take questions.
There are no questions in the chat, but I would invite them to also unmute themselves if you want to ask a question live.
Yeah, be brave. Let's hear your voices. Cortez is here from Southern Birth Justice Network. I love it. If you are looking for the report, you can find it on our website, YWCA South Florida.org. It is on the main page, the front page, landing page. There's a banner with a link so that you can go through all of it. And again, it was so fun to do this report. It was so funny to get some of the recommendations back because I was like, oh, accessible, yes. Oh, multi-platform. Yeah. Oh, every language, duh. But what is just absolutely mind-blowing is that these women are saying it's not happening. It's just not happening. So we really got to take a look at ourselves. Maybe a week ago, we sat with these recommendations with our leadership team and really went through them and talked about all of our sites. Are all of our sites doing this? Are all of our programs doing this? We have a lot of work to do,
I love
Anybody?
stories of self-reflection.
Yes.
I think Rachel unmuted herself.
Yeah.
Hi, Rachel.
Hey, friends. Thanks so much for doing the study. I was a participant in the study. So thank you for sharing the results. I was curious about that. I have not fully dived into the report beyond what you all have shared. I have it opened, but it sounds like resources continued to come up as something that was important, and the lack of access to resources or knowing that they existed. And even I appreciated the example of real time during the focus groups when people were talking about resources, people writing them down, right? So that was evidence that that was important. Could you share what were some of the just trends of the resources that they were naming, that they were seeking? So were they looking for, as an example, like a place that helped them fill out the Medicaid paperwork, or were they I just was wanting some specificity around just what were the resources that they were looking for, or even sharing as a person who might be curious to access or just to understand more fully the group's experience.
It was such a big variation, really depended on the person. So really targeting individuals rather than, thinking about women as a whole group, what matters to women as a whole group. That wouldn't be very helpful. But some examples, the very first focus group we had, actually, because it's first, it's still fresh, even though it's not so fresh, it's still in my mind. A big point of discussion was healthcare. And when we talk about healthcare, again, breaking it down into kind of bite sizes. Healthcare for whom? People talked about healthcare to them for themselves, and specifically age-related healthcare, right? Perimenopausal, postmenopausal healthcare. Others talked about at the stage of at the younger stages, at the maternity stage, right? Maternal health. Others talk about healthcare from the perspective of trying to seek services and provide support for usually elderly adults to whom they were giving care, right? Who resided in the households and who were relying on family members for caregiving. So that's one example. Another example I remember was with some women mentioned educational opportunities. How do we find scholarships? As simple as that question. Another one was and especially for the younger age groups, the ones who have children or whose children, maybe are in school now, but recalled the challenges they had with childcare. How do I find a good facility? And we were like, I was surprised because, okay, we have the Children's Trust, we have the Early Learning Coalition. I mean, we know these resources exist. Yet women tell us, how do I find them? How do I know it's a good childcare place for my child? How do I know they have the slots? Right? These very basic questions that we think information is easily accessible for, they were raised by women. So to Sarah's point, we think we're doing a good job. We think we have a lot of resources and information out there, but somehow it doesn't reach the people who need it.
Thank you so much. That was super helpful. I
Of
appreciate that.
course.
Rachel, I want to give you like a little tip on it. Starts at page 29 of the full report, and it goes through each of the types of resources, and then the ones that we actually heard mentioned, we noted them in those pages.
Awesome. Thank you so much. I
You're
appreciate
welcome.
it. Thanks again for your work.
Thank you for being here. Yeah, I mean, mental health and emotional well-being it looked like to me a lot of resources listed, so I felt better about that one.
That one was pretty interesting, mental health, because some participants noted that there was still like a large stigma associated with mental health, particularly in certain communities of color. And that was very interesting to hear from our participants that they may not necessarily have encountered barriers accessing, but that people were afraid to reach out
Yeah,
and find out this kind of information to begin with.
absolutely. Any other questions about the report, about our process, about what we learned? Any takeaways? Any any plans to do some, I don't know, some reviews, some internal reviewing?
Good
Okay.
afternoon, everyone. I just wanted to add, hi, Sarah.
Hi, Monique.
I just wanted to add, I think it was I participated in I think it was the last session at United Way. Very informal. And you all provided an opportunity for women to be really raw with the things that they're going through. And I don't think that we have enough of that. I know out of our discussion, it came up about meeting women where they are, being able to do that as it relates to resources. And I would have to say that the YWCA is on the brink of that, which I think is great. So I just want to say I thank you all for stepping out and trying to make a difference. Because if you think about it, as long as Miami has been around, we really haven't had a center source specifically for women. And I know we talked about that at our session too. So thank you all for doing this.
Yeah, and I think Monique, I'm glad you said that because, Monique, and I hope you don't mind that I'm sharing this, Monique came with a very interesting perspective in that she's all the way down south. I mean, Monique, where are you? You're super far.
Right,
That's all. Yeah.
Perrine, exactly. Yes.
She's in Perrine, and she
Yes.
talked about that feeling of isolation from the rest of the city. And that was huge for me, at least, I thought. Isolation, geographic isolation, linguistic isolation.
We're the last to get everything.
Yeah,
So,
the last to get everything. And
mhm.
imagine how that compounds with women. So,
Right.
yeah. Thank you, Monique.
Hmm.
All right, everybody. Well, if no one has any more questions or anything else to share, I'll wish you a happy afternoon. Um, Thank you so much for coming and listening. And like I said, we're going to keep this train going. We're not going to let this data just sit on a shelf and get dusty. So look out for all the stuff we're doing, and we hope you'll join us for another opportunity to do more. Yay, I see all the hearts. Thank you. Bye, Rachel. Take care.